And
Hi
then
guys, it's Sarah and my guest Julie Patterson again. And today Julie's going to tell us about another treatment that she's been doing called auricular therapy. I personally don't know anything about it, so I'm super eager to hear all about it. Hi Julie.
hi.
All right, so what is auricular therapy and what made you want to try it?
Well, I actually initially tried it years ago and I did it for a couple of years and then stopped for a while just due to, like money or whatever.
Sure.
But I really enjoyed it. And basically, what it is acupuncture of the ear, but instead of needles, they're using an electro-stimulator.
Oh,
So they can stimulate the ear with electricity on those acupuncture points or acupressure points, and then at different frequencies, whether they want to amplify that spot or tonify that spot. Um, or dull it. And the doctor is well trained in the areas, on what does what, and then you get to kind of pick the level of intensity. I I had fun with it because I kind of like it and so I'd always tell him it's got to be higher, turn it up, and he'd just laugh because he had me and one other guy that was like a 300-pound burly type guy that
yeah.
had the highest settings, but um basically that's what it is. They're if you look up sorry, the pressure points on the ear,
Hmm.
there are a gazillion, it seems like, just tons and tons. And so you might have maybe heard of ear seeds. Some people,
Yeah.
he actually would give me some sometimes to take home so that they're little stickers with a seed. And depending
Mhm.
on what type of metal it is, it either amplifies that spot or tonifies that spot. And so then you can rub it at home. But when he does the treatment in the office, it's with the electrical stimulation. So for me, um, what I was going for was basically, tight muscles, aches and pains, sore back, things like that, sore neck,
Mhm.
sore muscles in my shoulders from work. And what it felt like, the different spots that he would hit for me, it felt like a massage from the inside out, which
Oh,
sounds really weird, but
that's
I've
cool.
had different types of really intense massages like Rolfing and things like that,
Mhm.
and never really got a good response.
Wow.
And that was pretty much the only thing that I felt like really truly where my muscles would let go. But the treatment itself does treat other things.
That's so interesting. So I have to say, when you were saying turn it up, I was picturing Princess Bride, where you it was on that table and
Yeah,
get.
I mean, you're not really being stretched, but but yeah, um, yeah. I mean, everyone has different. It's kind of like if anyone's ever had dry needling. I recently did that for the first time, and it reminded me of that. But that is actually with needles, but they hook that up to electricity too. But it was a totally different type sensation
Okay.
when they do it on your ear.
Mm.
And it's just amazing that it's kind of like your foot. I mean, we've all heard of foot reflexology,
Yeah.
and your whole body has areas on your foot that it corresponds to. Your ear has the same things,
Yeah.
same type of situation going on.
Do
So, oh, go ahead.
do they do one point at a time, or do you have
Yes.
like all these things connected to your ear at once?
No, he basically has just a wand, like a pencil,
Oh.
and then puts it on the different spots on your ear, and then I don't know the seconds, the exact precise
Mm-hmm.
amount of time for each setting, but if he's tonifying it, he does a certain amount of seconds, and if he's amplifying it, he does a different amount of seconds. And
And can you
so
clarify, tonify, and amplify?
um so amplifying it is you're awakening it,
Okay.
like you're trying to get something to happen. And
Mm-hmm.
tonifying means it's already too active and you're trying to bring it down.
Okay. Gotcha. Gotcha.
So
Cool.
Yeah, so trying to calm, like for say, for instance, the nervous system, you're trying to bring it down.
Okay.
Um, so then he would tonify those spots. Um, the chart, if you're just curious, I mean, seriously, look up the
Hmm.
pressure points on an ear. It's just crazy. And
Yeah.
then the treatments, like, he has a chart on all the different points on what they treat, or what they're used for. And
Hmm.
it's just crazy, like how many different things
Yeah.
that they can use it for.
I have seen ear reflexology charts. I've just never heard of it with like electrical stimulation, like you're
Right.
saying. So then I'm curious for somebody that's never done it before, does your ear warm up and get like red like it does when you're rubbing it? Or do you feel like tingling? What does
Yes,
it feel like?
both. It does get warm, and can be kind of red I mean, it doesn't last very long, but
Yeah.
the points feel different. It's funny. One point might feel like kind of a sporadic thumping, if that makes sense. And the
Hmm.
other spot will feel like you grabbed, like a hot fence.
Really? Oh,
So,
wow. Okay,
um,
some yeah.
and like you laying on the table, you don't know what the next spot's going to feel like. So it's kind of a surprise,
Does he
kind
go
of an
in?
adventure that you're going on.
Does he go in order so you can kind of anticipate, or does he just like
No,
random?
he goes based on your needs, and then
Okay.
he kind of charts a course himself on what order he wants to do it in. So
Oh,
you have a
interesting.
consultation prior to um the sessions, and like, I mean, especially if it's your first session, he has a longer consultation. But if, like me, I had multiple sessions, he knows me pretty well. So like
Yeah.
even now, if I walk in today, which I have had it recently, but he we'll talk about that later in a different interview, but he referred me on to another type of practice that he
Mhm.
thought would help me better in my situation right now.
Okay.
But if I were to walk into his office right now, he would know exactly pretty much what
He knows
points
your
to
ear.
hit on me. Yeah.
Yeah, that's
Um,
cool. Does it help with anxiety and panic attacks?
yeah. Uh-huh. It can
Okay.
help with that. Depression, different maladies, diseases.
Hmm.
Um, I'm trying to think. Seems like they even had a spot for like addictions and
Hmm.
just tons of things. It
Yeah.
just blew me
Yeah.
away. Like I thought it was really cool. They
So
use it
not
for
just
a
so it's not
multitude
just
of
like
treatment.
sorry, cut you off. What was the last sentence?
Oh, I just said it can be used for multitudes of different
Oh,
types of things to treat.
gotcha. So it's not just like organ by organ, like let's work on my kidney today. It actually can work on emotional and traumatic things as
Yes,
well.
it can be emotional, but it
Psychological.
can be physical as well. So, like his wife went through cancer,
Mm.
and so he worked on her with her cancer as well.
Oh,
So and I mean, that's an extreme,
yeah.
obviously. There's milder things that he could work on, but like, say you had, um, I'm trying to think. I wish I had
Well,
um,
like
the
migraines
chart in front of me.
or needing to lose weight, stuff like
Yeah,
that.
hmm yeah, they have some of that. How people respond to it, of course, everybody's different, which is it's just like that's with any medication, any
Yeah,
treatment, anything. But
true.
yeah, absolutely, they have spots for that.
Okay. So what's is there a difference in your opinion in how you feel after this treatment compared to like acupuncture?
Um, Yes, for me, it was a better experience than acupuncture.
Okay.
I've done a lot of acupuncture in the past as well,
Okay.
and for me, it was a better experience because I had more relief
That's so interesting.
from this. Yeah, and I don't know why. I don't know if it was because it was electricity
Hmm.
or if I don't know why for
I
sure,
have
but
a
I mean,
hypothesis.
the acupuncture I had was full body acupuncture
Yeah.
as well. But yeah, I've had better results with the auricular personally.
Yeah, yeah. I just had an idea. I'm just guessing, but like you say, the electricity probably stimulates more than just a needle, and then the fact that it's so close to your brain and your spinal cord. your ear is so close, it kind of almost makes sense that it would send the signals through easier than just like sticking a needle in your side. You know what I mean?
Well, and I do remember when I was having acupuncture, I don't remember the timeline if it was the same, like if I was having these treatments at around the same time. It was
Hmm.
close though. But I do remember having the acupuncturist put needles in my ear.
Yeah.
So then auricular wasn't foreign to
Similar.
me. It made sense, you know.
Yeah, yeah. Okay. Except for it just has the electricity part with it. That's so
Yeah,
interesting.
and
I
no
wonder.
needles. Yeah,
Oh, yeah, right. No needles.
because
Okay.
that
That's
can be a big thing for some people. Yeah,
yeah. Oh, good point. So it's an alternative treatment for someone that's afraid of needles.
right. Yeah, no needles, just an electrostimulator, and it's
Yeah.
like I said, like a pen.
So I wonder if somebody can buy one and use it at home on themselves.
I'd asked him that, um, and you kind of can. It's kind of like a TENS unit, but
Yeah.
to know what spots and to know which ones need tonified and amplified, and to get
Mhm.
them like exactly right. I mean, people go to school for years and years for that, and
Yeah.
as he did, and so
Is that
I mean,
all
you
he
can
did,
use
or
like
was
the ear
it
seeds and stuff at home,
yeah,
and not do like many crazy things, but
yeah.
um, he didn't really recommend that just because of that reason, the training, but also because the type of like electrostimulator that he had was,
Mhm.
quite costly,
Yeah.
and you'd have to be able to adjust the settings too as you go. Whereas
Mhm.
when you're doing yourself, I don't know if you'd be able to do that. You probably
Yeah,
would if you
I
were.
get what you're saying. It'd be complicated. Was
Yeah.
that his only modality, or was he like a chiropractor that did that on the side?
No, that's his modality. Yeah, that's what he
Wow.
does.
Okay. So yeah, it probably does take a lot of training.
Yeah.
Um, Interesting. So you you were going you felt relief. You basically came out of there feeling a sense of like you had a deep tissue massage or something. You felt
Absolutely. Yeah.
super
And
relaxed.
honestly, better than that because
Really?
when I
Cool.
get massages, they still can't get my muscles to release usually.
Yeah.
They're just so tight. And so, this was at the time the one thing that would actually get those muscles to release.
You definitely got me wanting to try it now because
Yeah.
I
It's
love a
pretty
good
cool.
deep tissue
Yeah.
massage
Yeah.
and
So,
just better than that. That's awesome. Side question: have you ever had cranial sacral therapy?
oh, I guess I kind of lied. He actually does that as well, and
Oh,
and he would do the auricular and the cranial kind of in one session. He
I'm
kind of
on
tied
to
it
you,
together.
girl.
So yeah, and I mean that's kind of one of those. Cranial sacral is one of those things where if you go to one practitioner, you might have one experience, and you go to a different practitioner, you're going to have
Yeah,
a different experience.
yeah.
So I've only had the experience with him, so I don't know. I haven't gone to someone that only does cranial sacral.
Right.
But yes, I have had it with
Okay.
him.
So, if you just have the auricular therapy, is it pretty quick? Is it like a 10-minute deal and you're done?
Oh
Or
no, it's like an
oh,
hour appointment.
really? Oh,
Mhm.
okay.
Yeah.
Interesting. Okay. Trying to think of some other questions. So it's not, it could be painful, but you can always ask them to turn it down.
Oh
And
yeah. I mean, he can turn it down to a very low level if you want to, but I like to have the
there's a
sensation.
side
Even when I
effect.
go get a massage, my favorite part is when they use their elbows. So, it's like
You like the pain. I
I
love it.
do. I want to feel what I'm paying for.
Sounds like a Rihanna song.
Yeah.
Oh, that's cool. Yeah, feel what I'm paying for. I like it. Get my money's worth. Um,
Right.
well, cool. Okay. Well, I guess we will continue on to the next modality on the next video. Was there
Okay.
anything else that you could think of that you thought maybe audience would want to know about auricular?
What I would say is if it intrigues you, look it up. Um, they do have a site where you can look up practitioners as well. It
Mhm.
doesn't mean that all practitioners are on that site, but um, uh, I recommend trying it. I recommend anybody try it because I just thought it was
Okay.
the coolest thing. And the fact that I was able to kind of stumble upon him and his treatment,
Yeah.
like I said, I saw him for years and then went a few years without seeing him and then started seeing him again this past year with some new issues. And it's a cool experience. I love it. It's one of those, you don't dread going to that doctor, at least
That's
I didn't.
awesome. Yeah, yeah. You're just gonna walk out of there feeling like jelly. It's gonna
Yeah.
feel good.
Yeah.
And then if people are looking it up, if I recall correctly, it starts with an AU, AUR. Oh,
Auricular.
okay, UL. Okay, cool. Thank you. No, that's wonderful. Well, thank you, Julie.
Yeah.
For my audience, I just want to throw this out there. I would love to interview anybody that's gregarious and not afraid of being interviewed. So, um, my sister's been awesome for this. But if you have an interesting topic that you would like to share with people, please look me up in the contact details, and I would love to have you on my guest or on my channel as a guest as well. Um, so thank you, Julie, for your time
Yeah.
tonight. And next time we will be back to talk about yet another therapy type.
Sounds good.
All right. Have a good night.
Thanks. You too.